So, hi everyone, welcome to this information session about the blood pressure awareness raising and testing grants in community settings. Appreciate this has gone out in really short notice, so thank you so much for joining us. I will be sending out the slides and a link to the recording with everybody here today and some others who couldn't make it. So if you know of anyone else who wanted to come but couldn't, just let me know and I can share the slides with them as well. So I'm Lydia, for those of you who don't know me. I work in Leeds Public Health as a health improvement specialist in the long-term conditions team. I'll just be introducing today's session, but I'll hand over to my colleague Rebecca, who's on the call as well, who'll share a little bit more about the grants later on. I'll just go to the next slide, sorry. So in terms of the aims of today, so we probably won't take the full hour, but at least we've got it if anyone has any questions and wants to chat anything through. But the aims of today is just to learn a bit more about the upcoming grant scheme. So we'll talk about the funding that's available, expectations, and who's eligible, how to apply, and like I say, the opportunity to ask any questions. I just wanted to give a bit of background first about blood pressure. So some of you might have seen this or will be quite familiar with blood pressure information, but I just wanted to give a bit of background just so we're all on the kind of same page. So yeah, hypertension is another term for sort of persistent high blood pressure, and it's a really serious public health issue. So more than 1 in 4 adults in England have high blood pressure, which is the third largest risk factor for premature death and disability after smoking and poor diet. So hypertension is quite unique in a way in that it is a risk factor in itself for cardiovascular disease and things like strokes and heart attacks. But it's also, yes, it's a risk factor, but it's also a condition in itself. But we know that people living in the most deprived areas are 30% more likely to have high blood pressure than those living in least deprived areas. And we know that at least half of all heart attacks and strokes are associated with high blood pressure in the UK. It's also a major risk factor for lots of other conditions, like I say, so heart failure, dementia, and chronic kidney disease. So 1 in 4 have a diagnosis of high blood pressure in England, but more than 5.5 million people are expected to have undiagnosed high blood pressure, and therefore they may not be managing it well with the required medication or may not be aware of lifestyle changes that may be required. So yeah, really big issue. These are the national stats, but we know that there may be up to 100,000 people in Leeds who have hypertension but don't know it. So there are several risk factors for high blood pressure, some of which you can't help, some of which you can, but the ones you can't help, the list on the right there. So age, ethnicity, genetics and gender. Anyone can have high blood pressure, but these factors just increase our risk. So generally from age 40 onwards, risk increases more. People from Black African, Black Caribbean and South Asian ethnic backgrounds tend to be at greater risk too. South Asian, Black African and Black Caribbean communities also tend to be more prone to developing type 2 diabetes, which in turn can also increase the risk of having high blood pressure too. Also genetics, so your family history of high blood pressure will have an impact, so particularly in your immediate family, that can really increase your own risk. And also evidence suggests that men have higher levels of hypertension and also lower awareness typically of hypertension than women. But then on the left, there are fortunately things that you can do to change your risk. So these include reducing excess salt in your diet, having a better diet more generally, so lots of fruits and vegetables. People living with obesity and overweight tend to be at greater risk, as well as excess alcohol, smoking, lack of physical activity. Deprivation and socioeconomic status also have a really major factor to play. There's lots of emerging evidence about that, but also mental health and stress. So although it's really serious stuff, there are things that we can all do to lower our risk. And through this project, we really want to raise awareness of how we can do this. So this is my last slide before I hand over to Rebecca to talk more about the scheme itself, but just wanted to kind of highlight the local data. So we've looked at the national data, but locally in Leeds, this is a bit of an old map, apologies, it's from 2021, but it's data showing the number of people per ward in Leeds who smoke, live with obesity and don't have a current diagnosis of hypertension and are living in the 10% most deprived areas. So the darker the colour on the map, the more people there are with these risk factors. There is a current grant scheme going on in Inner South Leeds. So the reason that we want to focus on West Leeds, Woodsley and Holt Park and Morley and District local care partnerships is not only because of this data, but some other data that we have too, and other interventions have focused on other areas within Leeds. So we want to reach these 3 LCP areas with this funding. But I'll hand over to my colleague Rebecca now, just to talk a bit more about the grant scheme itself, which I'm sure is the reason why you're all here today.
Thanks, Lydia. Hi, everyone. I'm Rebecca Taylor. I'm a Senior Programme Manager at the Leeds office of the West Yorkshire ICB, and I'm the Commissioner for the Community Blood Pressure Checking Programme. So if we've gone to the next slide, please. So I'm just going to give you some overview and aims of the project. So the funding for this project came from the Healthy Working Life Fund, which came from the government at the beginning of April 2025. So as Lydia said, we implemented a first phase in September this year, and now we're sort of looking to expand across the city into the areas that Lydia mentioned previously. So we want to improve awareness raising and prevention. We want to raise awareness of the important role that blood pressure plays in our health, help communities to better understand risks, signs and symptoms of high blood pressure, to improve access to blood pressure reading equipment locally and normalise having a regular blood pressure reading, and help communities to know their numbers. There's also a making every contact count element here as well. So blood pressure checks create a natural opportunity to start conversations about health and lifestyle. Staff at the community organisations can signpost individuals to local support services and resources, and we've got some really great resources from the Public Health Resource Centre that are available for free or for a small printing cost, which is really, really helpful. And I'm sure Lydia's got some documents and things relating to them that she can send round after this. It builds trust and familiarity. There's already trust and familiarity built with community organisations, so that encourages people to engage with their health a little bit more. And there's also a social prescribing element within this that I'll come on to talk about in the next couple of slides, but social prescribing can help encourage conversations around further support that's available regarding the wider determinants of health. And then, of course, we've got the improving healthcare outcomes. So we know that early detection of hypertension reduces the risks of stroke, heart attacks and kidney disease. Increased awareness and self-management of health conditions leads to better long-term control and better engagement with prevention services, including NHS health checks and lifestyle programmes. So the available funding, so in total we were given £150,000 to fund the overall project. So an initial phase was launched in Inner South Leeds in September 2025. So we're now left with about half of that. So we've got about £75,000 for this element. So funding will be given based on a tiered approach, and this is similar to the approach that we took in Inner South Leeds as well. So up to £1,000, there's no set minimum blood pressure checks you have to do. Up to £3,000, we would expect around 75 blood pressure checks, and up to £5,000, we would expect about 100 blood pressure checks. Obviously, you can exceed those targets. That's just sort of the minimum that we're setting for each tier. So funding will be given from West Yorkshire ICB as a grant agreement, and it's going to be non-recurrent, so it will end on the 31st of March 2026. And it's open to all organisations in West Leeds, Woodsley and Holt Park and Morley and District LCPs. Next slide, please. Okay, so we've got expectations of grant holders. So we want all the organisations who are taking part. So we've got 13 taking part in our South Leeds. And obviously, we've now got this phase. So we collectively want all the organisations who are taking part to support the overall goal of 5,000 initial blood pressure readings. So that's not that every organisation is to take 5,000 readings. We are hoping that the targets that we've set will sort of collectively add up to 5,000 readings. And we've got obviously over a 6-month period. So this phase will be a slightly shorter and will take place from January to March. And as I said, the Inner South one started last month. There'll be a training session facilitated by Public Health to ensure that staff are informed on how to measure blood pressure and where to signpost as per the project pathway, which I'll share in a few slides' time. That'll be an in-person training session, and we'll also have a pharmacist from the Medicines Optimisations team within Leeds ICB who will come along, and he can help sort of answer any clinical questions that you have and also sort of show you how to use the cuffs, how to calculate average readings, various things like that. We want you to follow the provided guidance on where to signpost someone based on the blood pressure reading as per the NHS guidance available at that website. We want to provide information booklets, and as I said, these are available from the Public Health Resource Centre. So there's a really great one from the British Heart Foundation, which is Understanding Your Blood Pressure booklet, and that gives people more information, whether their reading was normal or whether their reading was on the higher side. There'll be a monitoring form that we will ask people to complete, and that will be shared with us at the end of every month. There's, as I said, blood pressure resources provided by Public Health, and we want them to be shared with members of the community. And then we want people who have had a high blood pressure reading to be supported to link in with linking leads, who are the social prescribers involved in this pathway. They've got a dedicated inbox. So you just need to send on the person's name, email address, and phone number, and Lincoln Leads will respond to the request within 2 days. If the individual doesn't want Lincoln Leads, which we understand it's not for everyone, we would ask them to be signposted to community pharmacy. And then at the end, we've got a small evaluation form that we'll ask everyone to complete to provide feedback to the project team on sort of how the project went and any barriers or issues that popped up. Next slide, please. Thank you. So as I mentioned, we've got Lincoln Leads involved in this. So some of you may have worked with them before and some of you may not have. And we do have some flyers and things from Lincoln Leads that we can send round just to give a little bit more information on the service as a whole. But within this project, they'll work with the third sector to provide the ongoing follow-up for those who have had an initial raised blood pressure reading. As I mentioned, when you send an email through to their dedicated inbox, it will respond to the referral request within 2 working days. They'll then provide holistic support to people identified with a high blood pressure reading, depending on their individual needs. So they've got a range of support that they can provide, from things like housing to benefits advice to sort of anyone who's job seeking, or they can help just with the sort of healthcare side of things as well. As I said, there's a project pathway, which I'll share in a little second. So Lincoln Leads will distribute blood pressure monitors and diaries for at-home blood pressure monitoring, and this will take place over 7 days. There's also a questionnaire called the EQ5D5L, which will be completed at the start and at the end of the intervention. And this just sort of assesses various lifestyle factors that are going on in the person's life and sort of their ability to work and things like that. They'll follow up with the person after 7 days of at-home monitoring to support them to calculate their average blood pressure reading, and they will also support to arrange follow-up with their GP if the readings are still coming back as being high. Once the person has had their GP appointment, they will then get back in touch with them if they're not already continually supporting them with other things, to sort of identify what the outcome of the GP appointment was and support them with any next steps. So it might be further testing, there might be treatment involved, or it might just be sort of lifestyle changes that need to take place. And again, this information will be captured and shared with the project team on a monthly basis. And then they also have a little bit of an additional form to fill in, which will go directly to NHS England for a sort of wider scale evaluation of all the projects within the Healthy Working Lives programme. So as I mentioned, here's the pathway. So up the top here in the sort of white bubble, we've got community organisations offer the initial blood pressure check to a member of the community as per the training. And once they've had that blood pressure check, there's typically 3 outcomes. So majority of people will fall under the normal blood pressure category, in which case then we would just ask you to capture the basic demographic information, offer them a blood pressure booklet, but they don't need to be signposted anywhere. Some people, a small proportion, may experience low blood pressure. If they experience fainting, dizziness, nausea, or fatigue, we would just encourage the person to book a routine GP appointment, and again, just capture their demographic information so that we're aware of how many people fall under these various categories. If they're not experiencing any of them, then there's no signpost required, and again, just capture their information. And then the area that I suppose falls under this pathway and we're most interested in is the high blood pressure reading. So there's 2 options, as I mentioned, for further support. There's the referral to Lincoln Leads. This is the preferred referral route, and we would encourage participants who are sort of getting the blood pressure taken to go down this route. However, we know obviously some people just might not be interested, some people might not find it appropriate. So there is the community pharmacy option there. For Lincoln Leads, if the person who's had a high blood pressure reading is aged below 40, they cannot be referred to community pharmacy. Some pharmacies may take their blood pressure, but as a general rule, pharmacies are only commissioned to take blood pressure in those aged 40 and above. So if you find that someone is aged below 40 and they really don't want to go to Lincoln Leeds, the only option really for them would be to make an appointment with their GP. So with Lincoln Leeds, as I said, they'll sort of help support that person through the pathway after their initial high reading, and hopefully give them a little bit of further support with their sort of treatment and diagnosis pathway if that's appropriate. There is one final category, but not very many people fall into this, but it's important to flag, is that there can be extremely high readings. And the NHS guidance for this is that if someone comes with an extremely high reading, they need a same-day GP appointment or to go to A&E if this isn't possible. It doesn't come up very often, but it can come up, and it's just useful to flag. And all of this pathway is based on clinical guidance. So there's the NICE guidance, and there's also NHS guidance that sort of follows the same rules. Okay, so this is probably the bit that's most interesting to you all, is how to apply. So we will send out, as I said, any key information, so these slides and also the expression of interest form and anything else that you need to know today after this workshop. So information that we're asking you to complete on the expression of interest form includes the amount that you're bidding for, so either the 1,000, 3,000 or 5,000, your proposal and timelines, what target populations you want to reach, and then your planned activity. So we want to know sort of how many activities are you planning on running and how many blood pressure checks do you think that you'll be able to complete within the 3-month time period. And then finally, just a little bit of a cost breakdown. So we're giving you around about a month to do this. So we're asking if we could have the expression of interest forms back by the 7th of November at the latest. And we then will meet as a project team to sort of discuss the expressions of interest and get the outcomes to you by the 14th of November 2025. As I've mentioned, we've got an in-person training session on the 3rd of December, and Lydia can send out some more information around that nearer the time. And then we would expect that your activity will be able to commence by the 1st of January 2025. I think that was my last slide.
Yeah, that's the last slide. So I guess, yeah, if anyone has any questions or comments, yeah, we'd really welcome them. Thanks, Rebecca. Jo, do you want to come in?
Hi, morning everyone. Thank you for that question then. So at whatever levels, say 75 or 100 blood pressure checks, is that individual people, not, you know, the same person who you might see a few times and monitoring them?
Yeah, individual new people. Yeah, appreciate you will probably see similar people at several events, or you know, regular groups that you run, but ideally it's new people. Again, they are just targets and something to work towards. So some of the current organisations that have received funding are kind of going into their existing groups, but also doing some kind of further outreach or kind of separate events, I suppose, to aim to reach more people. So that could be something that people might want to bear in mind.
Right, lovely, thank you.
Thank you. Councillor Marshall-Cutting.
Morning, everyone. Thank you very much, Rachel and Lydia. This is great. And I do remember about 2 years ago through Barker, we were able to get some ladies who were doing, I think it was over 3 or 6 months, and that really worked very well in our community. That's Little London Woodhouse and the city centre at the Leeds at the Little London Community Centre. And I tell you, till today, we still have people who come in and say, oh, blood pressure. And I'm like, I'm really sorry, they're not here anymore. So I think that will be great, because obviously we run the food pantry every Friday from there, where people are coming in every week. Now, the good thing with that is not, the food pantry is run by the Leeds African Community Trust. And if you look at your data and the demographics of, you know, what you have in terms of high blood pressure and the risk, what we could also do is not just wait for people to come to us. There are lots of events going on around the community, which we can say, right, if you give us a little table for even if it's just for an hour in your event, we can actually go there and get people, get them to take their blood pressures and then feedback to yourselves. So I think this is great. I would say it is well needed because we have seen it happen and it really, really helped. I know there was a lady who her BP was so high, it was unbelievable. One of the girls who was measuring on the day, you could just see from her face, and straight away, she was taken to the hospital. So I know this is some intervention that honestly it is so needed. So just to say thank you on behalf of our community and say yes, this is something we would definitely be applying for. Obviously, the fact that your numbers you're saying 75 to 100 different people. Yes, we do have the same people coming in every week, but we would be willing to go out of the community, take ourselves out there and see how many people we can get measured and obviously intervene where necessary. Thank you.
Fantastic, thank you. And yeah, that's really nice feedback and good to know that it's had such a lasting impact. I think, we've been doing other work as well in public health with community partners around this, not necessarily through grants, but I think community partners have found that it's been a really good way to continue to build that trust with people that they see on a regular basis and kind of, really support people out in the community. So yeah, thank you. Richard, do you want to come in?
Yes, and thank you both. That was a really clear and helpful presentation. I just had one quick question, which was, I know that equipment varies in quality depending on sourcing. Is there going to be a recommendation of equipment to get, or will equipment be provided for the trial?
Yeah, good question. So yes, we've got recommendations. Community organisations would have to factor in blood pressure monitors and different cuff sizes as part of their allotted funding. So yeah, it'd be on community organisations to buy those. We do have a really good list that's provided by the British Heart Foundation of some trusted, reputable blood pressure monitors. So yeah, we'll definitely be sharing that link with all successful organisations to use. But yeah,
Great.
Good question.
Thank you very much.
Thank you. Rachel, do you want to come in?
Thanks, Lydia. Morning, everyone. Firstly, if you hear banging, I'm afraid I'm having a wall knocked down today, so it might be a little bit disruptive. But I just wanted to pick up on what Abigail was saying about the work in Little London. It's just a wonderful example of how the community just really embraced a local offer, and it was 2 or 3, I think, community health educators that were trained up to deliver blood pressure, but also other additional health checks within the community. So they were doing like Audit C and Schwemmwebs as well with individuals, BMI as well. And again, just kind of linking with what Jo said about seeing people regularly. It was never the intention to see people on a weekly basis, but as the project went on, and I think it was 3 months and it was extended to 6 because it was doing so well, we did have ladies that would come back every week. Yeah, and they'd want to get weighed and have their blood pressure done. So they created their own weekly check-in, which was not what it was designed to do, but I just love the way that it was shaped. So I guess of any of the organisations that want to apply, obviously there's an aim to the project and a way that we kind of expect it to be rolled out, but it might be that you learn so much about your community and what they'd prefer, and it can then help shape future interventions as well. So yeah, I think if you know your local communities, then let's kind of just see what they make of it and what they demand as well. I think it'd be quite interesting.
Yeah, definitely.
Sorry, can I Rachel, if that's okay? So what we also did at the time, I got somebody to help with Zumba, and it was just for women as well, because depending on the community, you know your constituents. So they were measured just before they went in for their exercise, and they were also measured when they had finished. So what we were trying to also show them was the importance of healthy living and exercise to blood pressure. So that was very helpful. So throughout that period, 3 months and 6 months, we also got the same Zumba trainer, and she was also helping. So when the funding ran out, obviously the funding as well for the Zumba ran out. So we started Zumba last Friday, and we will continue that through to December. So if we're able to get through with this one, we're more than happy to put that Zumba as an additional value-added service to this, just to help people understand blood pressure, exercise, and all of that all in one go. So yeah, we would put all of that down in our proposal to yourselves. Thank you.
Brilliant, thank you. And yeah, I suppose just for some further inspiration, perhaps of what other people have done as well with the current round of funding, and we also ran a similar one at the very start of this year in January. But yeah, funding can be used for, well, it's not limited to this, but yeah, blood pressure monitors, some kind of additional venue costs, publicity and printing costs for materials. So people have produced posters, different online resources they've shared on their social media to not only kind of promote the blood pressure checking services or the blood pressure testing that they're offering, but just kind of general awareness raising as well, and some kind of volunteer and staff time expenses as well. Some people have done some really creative things, like you say as well, like some exercise kind of add-ons as well to kind of make it more of a holistic offer. But yeah, we've got some examples in the expression of interest form as a kind of just some further funding guidance. So I'll be sharing that, like we say, straight after this session, just so everybody's got that. But yeah, does anyone else have any questions at this point in time? If anything comes to you, obviously we're here, and you're happy to answer anything over email or by if we want to have a chat. But yeah, Rachel, sorry, do you want to come in?
Sorry. I was just thinking, I clocked that Mindy's on the call as well from Public Health, and Mindy has amazing links with faith organisations in the city. I'm thinking particularly about West Leeds, and Richard, do jump in if you'd like to, and Ollie as well. I'm thinking about some of our South Asian populations, particularly in Pudsey. Correct me if I'm wrong, but I think that they would access temples and the mosque into Thornbury. So I don't know how that would work if there was maybe an organisation that would want to support particularly men from a South Asian background. If a grant could be distributed, it would be Bradford rather than Leeds, but we'd know it was where those groups were going.
Richard, are you coming in to respond to that?
Have an answer.
Yeah, Ollie stuck his hand up as well, but I would say if we're going to deliberately target that population, you'd be looking at St James Woodall on Galloway Lane. We've got strong links and we could easily partner with them. But go for it, Ollie.
Yeah, I was going to say St James as well, because I know that some faith groups operate out of there now. We also work with residents in Tyersall, and that area is kind of become more diverse as well, especially the primary school. Because we were looking at engaging with older people through that, but actually this could be something that we could piggyback through the primary school as well, actually. Because that was one of my questions as well, is because we were looking at Tyersall, so it's one of our areas of higher deprivation. I suppose the problem there is that the residents tend to sit within the Leeds City Council boundaries, but I think for health, a lot of them are then accessing sort of Bradford, Thornbury, health centres. Now that falls out of the purview of this fund, is that right?
I think as long as we're reaching people in Leeds, I think, correct me if I'm wrong, Rebecca, because it's the ICB who are holding the funding, but as long as we're reaching Leeds residents, even if they're accessing GP services elsewhere, that's still okay. Obviously we're not going to turn down anybody having a blood pressure check if somebody who does live in Bradford or anywhere else. It's not like we're going to not accept them onto this programme, but I think linking Leeds have a specific remit around Leeds residents, if I'm correct. So yeah, I think aiming to reach as many Leeds residents as possible.
That's great. Yeah, so that helps for Tyersall then, because we would like to be able to do whatever we can for residents in Tyersall, because they always sit in that awkward kind of boundary there. But yeah, no, that's great. Thank you.
Yeah, thank you. Jo, I think you had your hand up first. You had to come back in.
Yes. Yeah, just a quick question related to what Ollie was saying there. How postcode specific is it? Because some of our programmes where we'd be looking to maybe tag that on, we might have people that are just outside of Morley area, but coming into Morley to attend things. So how much does that factor in?
Yeah, I think that's absolutely fine. Obviously, it's really hard, isn't it? It's not like just people who live in Morley are going to access Morley community groups or Morley services. So yeah, that's no problem at all. I would kind of just base it off the people that you see in your organisation.
Right, lovely, thank you.
Abigail, do you want to come back in?
Yes, me again. Sorry, don't get tired of me. Just something regarding the trainees. Are we responsible for recruiting them, or you would normally refer them to ourselves?
In terms of the people actually delivering the blood pressure checks, you mean?
That's,
yeah, so so there'll be people within your organisations who will be delivering the blood pressure checks. As Rebecca was saying, we are going to run a training session in December, so we're responsible for delivering that and supporting your staff with that. So yeah, don't worry about that. But yeah, like Rebecca said, it will be ourselves, a clinical pharmacist for those kind of clinical questions, and also Leeds Health Awareness, who I'm sure a lot of you might be familiar with, who have loads of community experience engaging with different populations and taking blood pressure checks. So they did a really good segment at the last training session, just kind of giving top tips for how that's worked for them in the past. Because appreciate, you know, organisations will have different levels of experience of doing this. So yeah, they've got a really good section in that training session that will hopefully ease any anxieties around that and make people feel more confident.
Okay. And one of the reasons why I was asking was when you mentioned the mosque. So we have one of the two biggest mosques as well in the city, which is the Makkah Mosque, as well as the Leeds Grand Mosque, all in my ward. So what we could do is see if we could link up with them as well and have somebody on Fridays during their prayers, maybe just before or just after, to also run a session for us every Friday, which will work perfectly because we're opened every Friday as well. So if we have, preferably, so the women are the ones who normally come to the food pantry every Friday, but we hardly have the men come. So if we're able to recruit a male volunteer who would carry out the health checks, I think obviously with cultural differences, we have to be culturally sensitive as well and match different communities to what works best. Because if we send a female there to be taking blood pressure, you know what I mean. So I think it will be nice if we're able to get through, and I don't mind writing to the churches and offering that service to them on Fridays as well, just before prayers or just after prayers, so that we could also engage, especially with the Asian men, in terms of measuring their blood pressure. Yeah.
Thank you. Mindy?
Hi, Lydia. Hello, everyone. Thank you, Councillor, for sharing that. With my remit around faith communities, Lydia approached me last week to say, can you reach out to some faith groups? So they're in scope, the Grand Mosque. So I'm meeting with the chairman tomorrow, and they're really keen to apply and set this up for their congregation. Also, the Woodsley Community Centre is also on board, and there's 2 Hindu temples in Leeds 6, so one on Kirksall Road and one on Alexander Road in Leeds 6. They're also applying. So I just wanted to put that in there. If anybody's looking to explore further links, then we can work together on it. That's all I wanted to share.
Thanks, Mindy. No, really, really helpful. Perfect. Well, if there aren't any other questions, we can end the session there, unless there's any final questions. But like I say, I'll send an email around after this, so you've got my contact details. If anything does come to you at a later date, please do get in touch. Yeah, we'll send a reminder of the dates, which are in these slides as well. But yeah, good luck with your applications, and yeah, looking forward to hearing your ideas and hearing back from you. Yeah, thanks everybody.
That's great. Thank you.
Thank you very much.
Thanks, Lydia.
Thank you.
Thanks, Monica.